Hello and welcome. My name is Steve Kessen. I'm our CEO here at Fathom, and excited to have you all join us today for what should be a really incredible roundtable discussion. So as you may know, we've been doing these over the last 6 weeks as we've all been quarantined to working at our homes. We figured it was good to bring marketers together for a discussion around just important topics that are happening in marketing today. And over the weeks, we've had various conversations around channel strategies, marketing automation, and paid advertising, and SEO, and so on. And we've also done a couple of industry-focused conversations. So the first was higher education, and today, really focusing on healthcare. So I don't know of any industry that's maybe been more impacted by the COVID world than healthcare, and us healthcare marketers on how fast we've had to adjust throughout this entire environment. So really excited for the collaborative discussion that we're sure to have today. As we get started and jump into the conversation, I want to just go over a few things that'll help make this the best experience for everyone. First things first, we love for participation. So when you do participate, go ahead and just go put on unmute in that conversation. I also want to use this as an opportunity to invite folks to turn on your video. I know we're all working in non-ideal scenarios here. We've got a few that are already sharing, but it's always nice to put a face to a name, and would love for people to share video if you're able to. From a technical standpoint, if you need support at all throughout this conversation, go ahead and put any of those questions that you have in the chat function. Also use that as an opportunity to ask questions if you don't want to interrupt the discussion and so on. So we'll be actively engaged on that. And lastly, this is really a conversation for you, right? This is a conversation for you to hear from your fellow healthcare marketers today, get a little bit of perspective from our team of experts that work with healthcare marketers across the country. But the conversation is intended to be a conversation and be ready to engage and participate. So in the spirit of, hey, let's make this a dialogue and not just a presentation, I'd love to have a few folks maybe introduce themselves. Maybe quick, who you are, what organization you're a part of, and maybe what you hope to discuss in the conversation over the next 55 minutes today. So why don't we go ahead and start with Sarah. Hi, Sarah, good to see you.
Hi, everyone. I'm Sarah. I work for Sharp Healthcare out in San Diego. We have 6 hospitals, and we represent a few medical groups as well. And yeah, I'm the advertising specialist, so I manage our relationship with Fathom and take care of all of our paid search campaigns.
Very good. Good to have you.
Thanks.
Ericka, would you mind doing a brief introduction as well? Oh, Ericka, I think you're on mute. Now we'll come back to you since the audio is not working.
There we go.
Oh, there you go. Hey, Ericka.
Okay, sorry about that.
Good to see you. No, you're good.
This is Ericka Smith, Director of Marketing for Stanford Children's Health. And I think I'm looking forward to just seeing how other organizations have been dealing with COVID for the last couple months, and sort of what the outlook is for the future and what they're focusing on.
Awesome. Thanks, Ericka. Good to have you. Maybe we'll do one more, and then so Emily, I saw you just joined on. Emily, would you mind just giving an introduction?
Sure. Hi, Emily Hext from Louisville, Kentucky. I'm actually in between jobs. Just wrapped up a stint at Humana, directing communications and marketing for Medicare, Medicaid, and individual medical. So I'm just really trying to stay abreast of healthcare trends and meet new people.
Very good. So good to have you on the line today. Perfect. So, and I would like to use this as an introduction or an opportunity for, if you didn't get a chance to introduce yourself, go ahead and just do that in the chat window. Just say, hey, your name, where you're from, and maybe what you want the conversation to go in today. So that way we can really tailor the conversation for what's most pertinent to you. Just so you have a little bit of perspective on who Fathom is and the point of relevance that we bring into the conversation, I just want to give a real high level 30-second overview about Fathom. So At Fathom, we're digital marketers who believe a strong strategy starts with deep roots. And it's deeply rooted really in three core areas. The first is in your business. We bring a lot of experience, especially in the healthcare vertical, but we recognize every health system and every organization is unique. So we always collaborate with our partners to understand unique challenges and goals for your institution. We then marry that with our own deep expertise in digital. And really what that does is provides a depth of perspective of what might work, what might not work, and really what's around the corner on all the digital strategies. And at the end of the day, it's all about driving an outcome. We collaborate with you to make sure we're measuring clear objectives and driving outcomes that really matter most to the business. So to give one level more of depth to who we are at Fathom, the types of services we provide, if you look in that middle column, we're a digital marketing firm. So it's SEO, paid search, organic, social media, marketing automation, analytics, and so on. So that's the vein of expertise that we bring into this conversation. And we really work across all of those with all of our different health systems across the country, solving a variety of different business problems. So enough about Fathom. Wanted to really start the conversation with a quick take and a quick perspective about what we're seeing in healthcare. And I have two of our fellow experts joining the line today. First is Tyler Alge. Tyler's our Director of Digital Strategy, and he's also joined by Jeremy Mathis, our Senior Director of Digital Strategy. And both of them will be sharing a depth of perspective today. They work on a lot of healthcare systems, honor roll systems across the country to help bring some perspective of what we're seeing. Also interested in collaborating to share what you're seeing. And interestingly enough about Jeremy, not only has he been on the agency side for the last 5 years with Fathom, but spent 8 years at University Health System here in the Cleveland area. So a major health system in the area. So without further ado, I'm going to turn it over to Jeremy to offer a quick take and perspective on what we're seeing in healthcare.
Yeah, thank you, Steve. Absolutely. So for those of us in healthcare marketing, these last 7-8 weeks have been quite a roller coaster. And I, was just thinking back on from the beginning of the year of where we were and where we are now and how quickly things have shifted. We had an opportunity here at Fathom at the beginning of the year, right at the end of January. We had a session called Healthcare 2020 that we hosted with Google in Chicago. I had an opportunity to talk with a number of you who are on the call here today in person and really share perspectives on what's happening in healthcare and where we see it going, not only in the next year, but in the next, 3 to 5 years. Had a lot of great discussion, a lot of great speakers, really focused in on advancing marketing and really looking at it as, we had a big presentation that Steve led on how to connect it to marketing efforts back to revenue and ROI, right? Always a big topic for healthcare marketing. So left that session feeling really energized and really excited about where we were able to go and what we were going to be able to do here, in the next year or so. And then, about a month later, we started to really feel the effects of the COVID-19 pandemic here in the United States. And then shortly thereafter, within 2 weeks, the World Health Organization declared a global pandemic. And then I want to say it was, not even 5-6 days after that, we started seeing the shelter-in-place orders for most of the states here in the country. And that's when our world, as both personally and professionally, drastically shifted in how we're presenting healthcare marketing. So when we look now around the response, right? So I think that the biggest impact that we've all felt is really in how care is being provided for our patients. And that in turn is affecting how we're able to promote that. So as we look, once the shelter in place orders came through, all elective procedures, non-essential procedures were canceled or delayed for an indefinite period of time. And obviously that has a drastic impact on the overall financial impact that we're seeing for hospitals and healthcare organizations. I think one of the stats that we've seen recently for hospitals in Illinois, It's estimated that they're losing $1.4 billion per month during this pandemic due to the closures and the inability to see patients in person for a lot of these non-essential and elective procedures. In addition, obviously, we've seen a big shift to telehealth and virtual visits. So for those of you who were ahead of the curve and really had a robust system in place to see patients virtually or through telemedicine, telehealth options, congratulations. I know it's been a struggle for a lot of healthcare systems who had been slowly implementing over the last several years. But obviously, this was a big shift and a big impetus to get that in play now and move forward with that. And I think in a bit, Tyler can talk through some of what he's seeing in the paid media side of how telemedicine keywords have really spiked here in the last several weeks. But the last thing, and probably the most important impact that we've seen, is really the impact on emergency room visits and urgent care visits as well. We've talked to a number of healthcare partners. So Steve and Tyler and I have all had conversations with partners across the country. And really the story there is very similar, where people are seeing dramatic reductions in the amount of patient visits that they're seeing through the emergency room. In some cases, we've heard up to 60% down in overall patient volume. And what's even more alarming is that these are for very serious health conditions. So we're hearing people not coming in for heart attacks, for strokes, for things of that nature, which we know the incidence of these, very serious health conditions didn't just magically pause over the last month, right? People are still having these health issues. But what's changed is people's perception. They are, afraid of coming into the ER. They're unsure if they can be safe, if they need to come in for health conditions. And that's really affected how people are receiving care. And obviously, with the severity of these issues, could have a dramatic effect on their overall health. Now, the good news is now that we're here 7 to 8 weeks, give or take on into the pandemic, a lot of the conversation has shifted, right? And so I think immediately we were all obviously taken aback. We're all affected, again, personally, working from home, dealing with family situations, if that's the case. Professionally, we've seen a lot of things happen where, non-essential procedures are now coming back online in certain states. So I know in Ohio, May 1st, they put the order out that these elective procedures that don't require an overnight stay can come back online. And it's up to individual hospitals to put a plan in place for how they want to do that. But really the conversation has shifted to how do we allocate resources now? And I think some of the more forward-looking partners that we've been talking through over the course of this pandemic has always kind of kept that mindset of, hey, we're all in this together. All hospital systems, all healthcare organizations are being impacted by COVID. But what we want to do is look to how do we set a foundation and how do we position ourselves in the right light so that post-pandemic, we're in a good position to rebound quickly and strongly to, again, provide the care that we know we can for our patients. And the last piece that's really jumping and really shifting and what we're hearing in the market now is that need to educate. So, as I mentioned previously, as we're seeing that dramatic decline in emergency health visits, I've also seen some things from oncologists and cardiologists that they're seeing, less patients, and there's some concern of what the long-term health effects could be for those serious health conditions. There remains a significant need to educate and also just to reassure our patients, to let them know that it is okay to come in for these serious health conditions. There are safety precautions in place, and really illustrating the steps that all of our institutions are taking now to ensure patient safety and to ensure that we are able to take care of the patients in the best light. So it's been an interesting shift, and again, like I said, early on, it was very much focused in on the short term. There's a lot of impact, as we saw, to healthcare systems nationwide. And now I feel like it's changing, and we're kind of looking ahead to the future and more long term of what we can do and how we can get ahead of this. So with that, wanted to give kind of a quick setup, knowing that this is impacting all of us, but I think we all have kind of a different perspective and maybe how we're addressing it. I'd love to open it up for some comments, for some conversation among the group, and just to hear how your organization is managing, your response to COVID, particularly with a focus on the future, knowing that, again, we're 8 weeks in and we're looking to see how we can rebound. So I'd love to open it up and just hear from anyone on the line who'd be willing to share and offer some perspective there.
I actually had a question for some other folks. Oh, sorry, Mary Beth, you go ahead.
Yeah, I was just going to say, so I'm with the Cleveland Clinic. Everything you said is spot on. Everything's moved virtual. Nobody's showing up in our emergency departments. So we've gone out with a lot of messaging around safety of our facilities. We just recorded new television spots with our CEO and digital, lots of digital display units and things of that nature, print ads, to just try to reassure the community that if they're having a stroke or a heart attack or anything like that, that they're coming in. Because, we're seeing people just not present and we know it's happening. So it's kind of scarier in my mind that we're not taking care of those people and that we're losing people that way instead of to COVID, because our hospitals are empty right now. There's just not that many COVID patients in Northeast Ohio.
Yeah, that makes a lot of sense, Mary Beth, and good to see you as always. But and to build upon that point, Mary Beth, one of the things that I was actually just looking at this morning was the search volume of people saying, is it safe to go see my doctor, or is it safe to go to the hospital? And it's interesting, in early March, you saw a huge spike in search volume from an index standpoint, up 5-6x. And then absolute end of March and early April, the search volume almost fell off because everybody was trying to figure out what's going on, right? And they weren't even thinking that an option was even to be considered to go see your physician or go to the hospital. But we've seen that search volume spike back up again, and we're starting to see more and more health systems put that messaging, and not even health systems. You see, I just got an email last night from the CEO of Marriott, right? Talking about how all the things that they're doing. So you see lots of industries that are starting to talk about that safety message. And I think that's important, because the nature of what's on the mind of the consumer, of the patient, is safety, and you have to speak to that.
Yeah.
So I was going to ask about the revenue cycle and reimbursement timelines for telehealth. Jeremy, you mentioned that obviously there's been a big shift towards that, as no surprise there. But I've been reading a little bit in the Wall Street Journal about especially smaller firms having issues with the revenue cycle and reimbursement timelines not being completely clear. And a lot of, you mentioned the financial risk is hugely elevated at this point. So if those timelines extend even, a little bit, that can be big trouble for a lot of firms. And I'm wondering if anyone can speak to how that's affected them, or if it's maybe not affecting the larger health systems quite so much, and it's predominantly smaller firms that are systems that are dealing with that.
Yeah, I mean, obviously I'd love to hear, for some others on the line. I know that there's been a lot of shift very rapidly, and I know that the government has eased up restrictions for Medicare for reimbursements there, and allowing more coverage of telehealth, telemedicine options, and we've even seen that among some of the large insurance providers as well. So Aetna, Anthem, Blue Cross have kind of, shifted to either temporarily cover that or reduce the payments needed to encourage people to take advantage of those telehealth, telemedicine options. And again, I think it's one of those where it's such a rapidly evolving situation. Even 8 weeks in, I feel like there's a lot of uncertainty, and people are still trying to figure out what's the best way to proceed with that.
Any of our health systems that are on the line want to weigh in terms of how you're seeing this in your health system as it relates to the telehealth side of things?
I mean, I can weigh in from our side. I mean, I think it's still very, it's very messy because we went from 5,000 virtual visits to seeing 20,000 virtual visits, basically overnight. And we're using several different platforms because the demand was so high. So it's a big piece of what I know as an organization, we're trying to figure out, how does reimbursement look from a patient being seen in, an actual office versus on telehealth? What does that look like? What's it reimbursed for from Medicare or Medicaid versus, private insurance, et cetera. So it's not clean cut for us, at least. And it's something that's going to continue to evolve. I think there'll be some big players that actually step up and can own this space moving forward as we get through this pandemic. I think it's a big space we can own.
Yeah, I would say the same thing for us. I don't have much visibility into how reimbursements are actually changing, and of course it's always going to depend on the payer themselves, which you don't have a ton of control over as a marketer. So what we're doing is, promoting telehealth where we can through primary and family medicine, and then just knowing that they'll refer into any specialty that will be better reimbursements if it leads to procedure or surgical volume.
I'd love to go to our first poll question of the conversation today. So, and I think one of the so the first question that we'll put up here now is, what's been your biggest marketing challenge during the pandemic? Is it the cutting or reallocating of budgets and that moving very, very quickly? Is it just the reality of the impact on our own individual lives and the lives of your teams? The changing care models, we've talked about telehealth a bit already. Uncertainty among the internal stakeholders and how decisions are being made, building patient trust during a time that there's a lot of concerns for safety or otherwise. So I'm interested in that, and we'll have a follow-up question here in a moment also that I'd like to get to. That is, where are you in this equation? Right, we've worked with a lot of health systems where early on there was a sense of community component. That's one of the most amazing things about health systems is the public good in which it serves. And there's no more important business than our health industry throughout a time like this. And we've really seen a lot of health systems step up and put a message out there to bring some level of coming together within their community, which also helps with some brand affinity, certainly. But there's a coming together effect, and so we've seen a shift in healthcare marketers going down that path and having to turn off some of your patient acquisition efforts because you might have not been able to bring in patients because of government restrictions, and B, just also probably good taste. But now we've got this financial problem, $1 billion for monthly in Illinois, and that's consistent really across all the states, across the country, across all our clients everywhere that are just now you're in the midst of a pretty significant financial crisis, potentially. So I'm interested to get a sense for where are each of you at in this journey of, hey, are we starting to turn on the patient acquisition side yet? What have you learned as you've started to turn on patient acquisition? I'm interested in I think the conversation there, because I think it's pretty pertinent today.
I don't want to dominate, but I can share that, we are starting to turn our programs back on. I think one of our issues is our visitor policy. People don't want to come in for surgical procedures when they can't bring someone with them. So it's a little bit of a challenge that we're having right now. People want to wait a little longer.
Yeah, I think we're having similar issues. We are definitely trying to get back to patient acquisition. I think the big question is how comfortable people are going to feel coming back in. And being a children's hospital, we have a lot of kids with compromised immune systems. So parents are terrified about even leaving the house with their kids. So we've done a lot of messaging about, the safety protocols we've taken for our employees and for patients. The visitor policy is a big thing, especially with kids. They're used to having their mom and dad there, and now we're saying you can only have one. Also on our OB side. So I think we're definitely in patient acquisition mode and trying to wrap that around. We know we want you to come in for primary care because we want your kids to stay healthy. We want kids with serious health issues to come in, and we figured out ways to do that safely. But I think it's yet to be determined how quickly people are going to feel comfortable.
No, absolutely. Thanks, Ericka. Sarah, anything that you might be seeing over at Sharp?
I feel like we were sort of just at a standstill for the past few months, and then just in this last week, we've been making decisions to, shift budget to things that don't slow down, like maternity, and then try and jump in where we can as far as the stroke and heart attack patients that are not coming in for care, seeing what we can do to just build brand awareness. So, and be sort of like that before they start experiencing symptoms or before they're diagnosed. How can we speak to those kind of people and remind them that we're still here? I don't have any real learnings yet since we just made that decision last week, but yeah, just Fathom's been super helpful in helping us understand which service lines should be a priority that we can increase budget, where we should just maintain, or where we should drop out if, like, locations are closed. Obviously, we would pause those campaigns. Just taking it service line by service line for now.
Yeah, makes sense. Tyler and Jeremy, what are you guys seeing from the various systems that you guys are supporting?
Yeah, so from my perspective, specifically looking at search, to Jeremy's point earlier, as we look at telehealth and telemedicine really increasing, so 737% increase year over year as we look at telehealth and telemedicine searches in just March and April. So huge increases there, and with the increase in that telehealth search, we're seeing a decrease in those proximity related searches. So over 40% decrease in doctor near me specific searches, but again, that 737% increase in telehealth. So we're seeing the consumer or the patient be much more likely to, again, research some of those more online services versus finding a doctor near them.
Yeah, I would say very, very similar. I mean, I think, as I mentioned, it's hit everybody, and everybody's figuring out what's the best way to proceed and navigate, not only the shelter-in-place orders and things that are happening in their own states, but then also the patient perception. And I think that's what I've seen lately is a deeper look at how can we, as I mentioned, how can we reassure patients? How can we help build confidence? Early on, it was very much a reactionary, as we all were, right, when everything was announced. And now I think there's a lot more intentionality with the messaging that's going out. And I think we've all talked about this, of just, how important it is to still come in for those important health issues, to reassure on the safety precautions that are being taken at these hospitals, so that we're not going to see, deaths or unnecessary severe illnesses happen because people aren't taking care of themselves because of, fears over COVID. I've seen some things with, even chronic medical conditions. There was a survey that got put out right at the very beginning of this. And they were saying, I think it was only like 33%, I think, of chronic patients that had responded, had talked to their provider around how are they going to be seen or how are they going to receive treatment during the lockdown order. And I think it just shows how this really struck all of us by surprise, and nobody really had it figured out early on. And I think now through telehealth and telemedicine, we're really coming back online.
Is there hard data available around HAI rates in major health systems that can be, used in part of that communication, or is that kind of more information that's coming out and evolving more ad hoc?
Yeah, I'm not personally familiar.
I don't know. Yeah.
Anybody on the line have a perspective on that? We're obviously watching a lot about what's going on with the patient, with the customer. And I think that's one of our jobs as a marketer always is to, not only how do we meet their needs from a services standpoint, which, you talk a lot about the shifting needs on how to receive your health services and moving to telemedicine and so on. But now it's also how do we shift the messaging and the communication and the discussion to help make them, more comfortable. And like we mentioned, there's a lot more interest in the conversation. Is it safe to go see your doctor or not? Emily put in the text in the chat feature there talking about like it's a little bit hard to understand who to believe during this time frame. This pandemic came on so fast, and you hear one piece of information today, and then tomorrow you hear a conflicting piece of information, and there's just so much information or misinformation out there, just because we're still learning so much a long time. I'm interested to maybe steer the conversation in that direction. In what ways have you evolved your messaging, and what are you seeing be most effective in serving your constituents with the shift in messaging?
I think one of the things that we have tried to focus on is the testing that we've done for our employees and providers, and also talking specifically about protocols. So if you are going to have a procedure or surgery, your providers are tested, you will be tested, and sort of also where any COVID-19 patients are being taken care of. So am I going to be in the same area of the hospital as they're going to be in? Those are kind of some of the worries that I think patients are having. So we're probably getting more detailed in our messages on those kind of protocols than we normally would, just to make sure that people, they really want to know exactly what is happening, I think, before they make an informed decision. I think especially since when all this started, we were saying, call before you come into the emergency room. Don't, we were canceling all these appointments and all these procedures. And now 2 months later, we're saying, well, where are you? Why aren't you coming back? So it is a very mixed message.
Yeah, absolutely. How about others on the line? What are you doing, and what are you finding most effective in your messaging? Thanks for sharing that, Ericka. Great insight.
We're doing the same thing, just promoting how safe we're being as much as we can. Distancing in the urgent care waiting rooms, things like that. And promoting telehealth where we can. We still need to be there for our patients in whatever capacity we can be when they need us. So yeah.
Great. I'd love to share the results, if we can, of the poll question on what's the biggest challenge here. So it seems like the largest items are two: one, changing care models, and two, something else in addition. So each of you had a chance to respond on what's your biggest challenge, and we had a little bit of variety here. I'd love to have 2 or 3 people maybe voice over what you're seeing as your largest challenge, and might you get some support from another healthcare marketer on the line here. Anyone in the other category want to bring forth of, hey, this is what we're navigating that maybe we haven't touched upon today yet?
Well, I answered that something else, because being in the job market, I've actually had several companies where I was a finalist over the last few weeks, and they canceled recs at the last minute because of uncertainty over budgets and other things that were happening that were less in the healthcare system, but more in the payer world, medical equipment industry. So.
Yeah.
Go ahead, Jeremy.
Oh, sorry, Steve. Yeah, I was going to say. I mean, that was one of the things that we saw, as well. Again, going back to the financial impact, right? I mean, I think I was looking at some pieces that the American Hospital Association put out, and they were reporting, I think, like up to 200 hospital systems throughout the country had furloughed part of their workforce or frozen hiring. We're seeing people take, pay cuts or reduced hours in certain areas. So I think that's definitely a challenge as well. And as we're all looking at how do we continue to do our jobs and do it effectively, knowing that there are enhanced challenges with the pandemic and how we provide care and promote it. But we're also doing that on top of, possibly reduced resources and able to make that happen. So it's definitely a challenge that we're all working through here. And I think, hopefully as things turn around, we'll be able to move ahead.
Another area of evolution that I think is important for us all to consider as we think about how do we operate in this COVID world that we're all in, presently. We've talked a bit about, hey, the mind of the patient is evolved and changed, so therefore we need to adjust our messaging. We've talked a little bit about products and services, continuing to move towards telehealth. There's just so much more demand there. That's putting some strain on the operations of health systems, as well as, the idea of the reimbursement, and it's a little bit unclear and those sorts of things. A big part of marketing is, getting your message in front of the market. And, we've seen some pretty meaningful shifts in terms of just how people are consuming media across the board differently today. And just the way of how you get in front of the market, the cost getting in front of the market, and so on. So, maybe I can tap on you, Tyler, to share a little bit of perspective of, what are you seeing in just terms of general media consumption rates? People are locked at home trying to, stay connected how they best can. What voice could you bring to that part of the conversation and what we're seeing there?
Yeah, so not surprisingly, we've seen dramatic increases in the streaming world. So not just streaming audio, but also streaming video. So whether that be YouTube, I saw a stat yesterday that was from day one of the pandemic to now, and I believe this was pulled beginning of May. There's been a 17-time increase in the daily video content that's consumed on YouTube. So some interesting shifts when it comes to consumption, across audio and video, and it's interesting. So we're seeing more competition, specifically as we look at streaming audio and streaming video, but across the social space, we're seeing competitors pull out of the market. So reduced spend from the competitive landscape has really caused decreased CPMs and more efficient reach from a social perspective. So there are opportunities to get out in front of individuals, maybe to promote that brand affinity messaging, or more of the, our emergency departments are safe to come to messaging more effectively, knowing that competition has sort of pulled out of the market there.
Yeah, what's interesting there, Tyler, and I think I saw this for specific keywords in healthcare, but we're actually seeing more and more volume on desktop over these past few months. And I think, we've all been, as digital marketers, we're all looking at the prevalence of mobile and making sure, your site's mobile ready, you have landing pages that are going to be responsive, and really focusing on how important that is. And, with people staying at home and working from home, there's more of a prevalence on desktop searches, which was an interesting shift back. And again, it'll be, depending on how long this goes and what the new normal looks like, that might be something to keep an eye on as well.
So from a channel strategy standpoint, we'd love to have a few folks maybe share, what's working for you, or what do you have questions on of, hey, should we consider this or not? We recently were partnering with a health system pretty significantly, and for the first time they're using Snapchat as a platform for them. And it's not necessarily a normal platform that's used in a lot of healthcare marketing, but we're seeing some incredible results from basically a brand affinity community coming together type conversation there. But interested in what channels might you guys be starting to try or have questions about, or what might you see working? Anybody want to jump in on that?
I just put this in the chat, but you know, we've been trying to be as empathetic to people's situations and you know, new lifestyles as we can. So obviously people aren't commuting as much, so we've been canceling radio and out of home, and then reinvesting that money into connected TV or digital radio like Pandora and Spotify. I'm on one campaign where we have this direct mail program where we target people who are new to San Diego, and then we offer them a free thermometer when they, like, assuming that they have kids or they just need one and it has our little logo on it. But since COVID happened, our response rate has gone up so much, and I'm not sure if it's because people are afraid of getting sick and need their temperature taken, or if people are actually like, I guess, spending more time opening their mail and more excited to get mail. So that's been interesting.
Yeah, that is an interesting perspective. I'd be curious if anyone else is seeing a shift in that as well. I mean, so, you know, you think about it, it makes a lot of sense. I mean, out of home advertising, drive time radio spots, that sort of thing are all meant for commuters, right? For people leaving their house. And obviously with everything going on, you know, as Tyler mentioned, people are at home. They're on the computer, they're on their devices. There's a lot more streaming services available. So I'd be curious if there's anyone else seeing a shift like that in their media allotment. Are they, you know, pulling back from traditional and shifting more dollars into digital?
Sarah, when you were, you know, making that shift, canceling radio, OH, all that, was there a conversation about, okay, we have, you know, how do we communicate with this older population who's still living at home, who's the most vulnerable population of this? We still need to, you know, dedicate X, Y, and Z resources to that. Because I mean, obviously, like, you know, Jeremy was saying, targeting commuters is probably not the, you know, best plan in the world right now. But at the same time, like, this very vulnerable population, you know, maybe isn't quite so much into the digital content. So I'm just wondering what that conversation and strategic decision looks like on your end.
I don't know if we really broke it out by age group. For us, we're always surprised at how well we do with seniors on Facebook and social. Like, they are a lot more social than we often would imagine them to be. I think the only thing I can think of as far as that is like our Medicare advertising, you know, shifting creative from these outdoor pictures of older people with their families to people attending our Medicare seminars on a screen, doing it virtually, and sort of tying the technology and senior population images together more than we used to. Yeah, I don't really know how to answer your question perfectly, but that's just what comes to mind.
If you have an older population, I mean, if your digital content hits, you know, multiple demographics by age, then good for you. I have to put you in touch with my grandparents.
Yeah, and I'm sure oops, sorry. I'm sure that population is still, you know, doing a ton of research, just like anyone else getting COVID-related news. So if you can do like contextual buys on and show up with display ads on relevant articles that could speak to them, I think that makes sense. You know, they have a ton of fear, so you could leverage that.
Yeah, I was going to say, Tyler, I don't know if you have any thoughts on that too, from a digital media perspective, on what you're seeing with, you know, the older demographic and going after that population.
Nothing specifically to older, but this conversation kind of makes me think about, to Sarah's point, Medicare and how we reach that older demographic in Medicare. We have seen positive results from leveraging social there, but also taking more of an influencer strategy there has also worked out well. So the caregiver influencer type strategy, as we really target that demographic, is another way that we can engage and, you know, try to reach that older population.
That's an interesting point. Thank you.
Yep.
I think there's a little bit of a misnomer out there. I think people often think of social as a kind of a young person's game, but if you really look at the growth in the various social platforms over time. The largest growth that's happening in Facebook is with the older demographic and so on. Now, Snapchat and TikTok certainly have skew younger, but with that being said, we've seen significant growth in Snapchat just over the last 18 months in that 30 to 40 demographic and so on. So as these platforms become more mature, you start seeing the younger demographic move on to the next thing. And you see, the older demographic really embrace the platform. So, we have seen a little bit of an evolution of how you might use a channel, 24 months ago is different than you use it today based on who you're able to reach and the nature of how the platform's used.
Yeah, and along with that, Steve, I know we had a conversation about this with one of our partners. You mentioned, using Snapchat for the first time now. And I think what's interesting is just the changing population in the country, right? And so, obviously the aging population, that's a big piece. But the latest stats that I've seen in the past few months here are that the younger generation, right, the millennials and the Gen Zs are now together the biggest population block in the country. And so understanding their needs and their expectations for healthcare, and looking at how do we, especially for that younger 20s group that are getting their own jobs, getting their own insurance, starting a family, getting married, that sort of thing. There's a lot of healthcare needs there. And there's obviously a lot of value if you can get, involved with a patient early on, and continue as you look at total lifetime value. So, getting them when they have their own insurance to select a primary care physician, to be brand loyal to a system, and then continue all the way through. I mean, obviously there's a host of health needs that change as you age, but certainly a lot of value in looking at that younger audience and understanding their needs and how they're consuming media.
Absolutely. So we're coming up towards the to the end of the hour here. I want to create just an open call for what questions, area of discussion, something you might want to get perspective on from a fellow healthcare marketer on before we wrap up today's session. Anybody have any additional topics you want to discuss?
Hey, Steve, this is Jim. I might be interested in maybe asking the group here about long-term predictions. And the beauty of long-term predictions is nobody's right and nobody's wrong, at least today in this moment. So there's no pressure. But as we work across a variety of industries, we can look at, for example, higher ed. There are defining moments in higher ed as we look back 10, 15, 20, 25 years. Digital transformation and sort of the proliferation of online education, even as it, you see traditional systems seeking to deliver the educational experience in new ways. That's a defining moment in the higher ed space. For healthcare, I would expect that in 10, 20, 30 years, we would look back and COVID would be a defining moment. But I'm not sure yet in what way. So we've talked a lot today about we're just sort of understanding the reality of the impact and trying to respond as health systems to it, which is totally appropriate. But if we fast forward 10 years and we all look back, what do we think the impact of this defining moment in healthcare as an industry might be? Any bold predictions or sort of curious thoughts as to what we would look back and say about COVID?
Well, I think one of the big ones will be moving people even further to telehealth and to digital platforms. I think especially in that older population where they were struggling with, can I trust it? Is it okay? Is my data going to be safe? I think they've been forced to use a lot of the digital technology and telehealth options because there was no other option to stay connected with their doctor or even with their family and friends. So I think that will certainly be something that we see over the next even 2 to 3 years accelerate much faster than it would have without this pandemic.
Yeah, we've done a lot of patient interviews to understand our population better and tailor the online products that we're making to fit everyone's needs better. And there's this one quote that we always think about, and we say, what should healthcare look like to you? And the answer is always like, it should be as easy as anything else I do online. Everyone brings up Amazon as sort of that go-to image of like great customer experience. And I think COVID is sort of forcing us to move everything digital and just be so much more seamless. Like even as a patient myself, it's just so tricky to navigate. And I think COVID's forcing us to adapt and be a lot more agile.
Sure. What's interesting to me is, so I have some personal experiences that I think the digital aspect and telehealth growing as a proportion of healthcare visits and healthcare in general makes a lot of sense. And yet we know that there's a lot that can't be done virtually. So one of my sons has had brain surgery. That's not going to happen virtually, at least in my lifetime. And so as everything else seems to be moving very quickly digitally, right? Think about financial services and the move to digital experiences there. Does healthcare become the owner in some way of the most human experience? There's going to be human connection by nature of the experience and the care you deliver. And so what's the opportunity for marketers to, yes, bring digital to the patient and to the consumer in the right ways, but also to sort of own the human connection and the human element that might be missing in a lot of consumer experiences. So I think that's an interesting opportunity and as marketers, I think we ought to own that. Probably not your most important priority tomorrow, but I would like to see that. And I'd like to be a part of healthcare systems that think like that and start building solutions and that, towards that end. So we can talk in 10 years and you can tell me I was wrong, but at least for today, it's an interesting idea. So.
I love it. I think that's a great perspective. I'll throw my own out there just for fun. Jim, I think you bring a lot of strength to that point, and I agree with it. I would also add, I think two things. One, you're going to see a whole new wave of healthcare technology supporting the virtual relationship with the physician to improve the experience that a patient can have in a virtual way to get diagnostics of information and that sort of thing between the physician and themselves. And then maybe more interestingly to doctors, and we'll see or to marketers, we'll see if I'm right or wrong on this, is I think you're going to see competition increase significantly, right? Because, you are potentially breaking down geographic borders, and you think about just how significant the competition is within a market. Right, you go into any major market and you've got a couple health systems, and it is a really aggressive, marketing battle in many respects. And you might see the amount of competition increase as people are more comfortable with telehealth. Might somebody in Kansas be just as comfortable going to see somebody in California, or Ohio, or Florida for a virtual visit as opposed to somebody that's just down the street? So I think you might see an increase in new competitors rising as you think of substitute services, coming on board. So it'll be interesting to see that trend as well.
And Steve, we've spoken a lot about telehealth today, but one of the other kind of undercurrents of all of that is the transition to value-based care reimbursement and the need for ongoing care and,
Right.
Post-acute care has been funneling the telehealth, EHR conglomeration already. So, obviously, yes, having a pandemic certainly boosts telehealth in a way that nothing else probably ever would, but there are compounding factors in that situation as well, which, obviously, I'm sure you're aware of.
Yeah, absolutely. It's interesting, adjacent, but, in our industry roundtable a couple of weeks ago on education, we had somebody from the University of Arizona make a statement that, digital is no longer a novelty. It has to be embraced by everyone, and they would run into challenges sometimes in a mature industry like higher education or healthcare in some instances, in terms of the way decisions have been made, and you can't avoid it anymore. It's a necessity. So I think you're absolutely right. Well, that does bring us to the end of our time together today, and I just so appreciate everybody jumping online today to be part of this conversation around a really important topic of our healthcare systems today, marketing in healthcare today, and so on. We do have a few more of these roundtable discussions coming up. So as you know, we do this every Thursday, 1 o'clock Eastern time. Next week, we're going to talk about change management. You know, I can't think of any other adjacent topic outside of change management besides tactics and marketing strategy that's more important. A big part of our job as the marketer is driving change. And it's true that the role of the marketer has, I think, fundamentally shifted over the last 5 and 10 years. And we're being asked to do new things and have new skill sets and so on. And in many ways, we are the great collaborators that are being asked to bring our customers together with the business, because we often, as the marketer, are starting to own the customer journey more and more. So we're going to speak to the importance of change marketing or change management as it relates to being a marketing leader. And then the last session we have scheduled is on the 21st, and we're going to have that as open dialogue, marketers coming together to speak really what's on their mind across a variety of different topics. So I encourage you to join us for those. Thanks for joining today, and I look forward to seeing you at the next one.